Hi, I'm Mike Hudson, Director of the Museum of the American Printing House for the Blind. Welcome to the Redux presentation of sessions from the Hidden Legacies of Helen Keller Symposium, which was held in Louisville, Kentucky on September 17th and 18th, 2022. The symposium, with primary sponsorship from the American Printing House for the Blind and the Filson Historical Society, brought together scholars, writers, and Keller enthusiasts from across North America. In 2020, the American Foundation for the Blind Helen Keller Archive arrived at our museum on 23 pallets. And since then, our staff has been busy cataloging, describing, measuring, and inventorying this most amazing history of one of the most amazing women of the 19th and 20th centuries. I'm sitting in front of her desk from her house at Arcan Ridge. Helen Keller was a writer, activist, advocate, ambassador, and world traveler who profoundly affected the way the world thinks about people with disabilities. And yet, she is little understood, often frozen in time as a little girl with her hand under the water pump behind her parents' home in Tuscumbia, Alabama. Our symposium was just a beginning effort to bring together the most current scholarship in innovative ways to better understand Keller, her companion Anne Sullivan, and her times. We hope you enjoy the series. Each session will be dedicated to a single speaker from the symposium. Our third session on Saturday afternoon was titled Tracing Evidence, Picturing Keller, Reproductive Advocacy, and Eugenics in the Progressive Era. The panel used film clips from multiple genres of silent films produced in the Progressive Era to explore how the U.S. public imagination was persuaded, or not, about different issues and values in public health, eugenics, reproductive control, and policy. The third presenter in that session was Dr. Brian Greenwald, director of the Schuchman Deaf Documentary Center at Gallaudet University. Greenwald explored how the deaf community successfully resisted and overturned the punitive legal reproductive restrictions imposed on deaf Californians in the 1928 to 1948 period. Joining the Department of History at Gallaudet University in 1999, Dr. Greenwald is a professor of history. He's co-editor of In Our Hands, Essays in Deaf History, 1780 to 1970, and A Fair Chance in the Life of Race, the Role of Gallaudet University in Deaf History. He has also published chapters in The Deaf History Reader and Genetics, Disability, and Deafness. And he is working on a book about the role of Alexander Graham Bell and the American eugenics movement.
Thank you so much for that introduction. So I know that time is of the essence, so we will move right into this. I am presenting the notion of eugenics in society, and specifically focusing on the California deaf community in the years 1925 to 1947. So we're going to look at the intersectionality of deafness, disability, and the state. And Dr. Golden already established the context of eugenics, so that's going to make my job much easier because that context has already been established. So at that time, the eugenics movement across America was happening during Helen Keller's lifetime and sort of central to that time period. And we know that there were approximately 30 states that had passed some sort of sterilization laws during this time. There were 30 states who had these laws documented. But there were different conditions that these laws were dependent upon. So there were certain expectations and conditions for sterilization. And for this, deaf people were not included. There's no documentation that says that deaf people would be included in these sterilization laws. So then that begs the question, why was this occurring? And what does that mean? So is this due to deaf people being a privileged group, maybe privileged amongst the disability community? So that is one perspective, but I feel like we can view this more broadly as deaf people and disabled people and just the politics of the state at that time. So I want to present the idea of studying why the states had certain groups of disabled people being more privileged than others, and why hearing people would prioritize certain groups amongst the disabled community, and how does that apply to us as deaf people, and how does that fit the legal definition of deafness, and then the perspective of hearing people and their view of deaf people at that time. And then during this time, as eugenics was spreading across America, we will look at how society at large responded to this. So we're focusing on the state of California and its passing of a sterilization law, being the third state to pass such a law. This occurred in 1909, and this law specifically focused on mental and cognitive impairment, such as mental retardation, and a list of criteria associated with that realm. So if someone was identified to fit those specific qualifications, then they could be a candidate for sterilization. Deafness was not included in this. And this continued on record in California for many years. So historically, we can say approximately 60,000 Americans experienced sterilization. However, there's no way to know that number in any more precise terms. We're looking specifically at California and what we have documentation and proof from that time period. So there's a picture on my slide. It would be to the left of the slide. The picture is of a gentleman wearing a Stetson-styled cap with a tweed jacket and a tie. The jacket seems to be plaid, and he has a mustache. This gentleman's name was Harry Laughlin. He was from the state of Missouri. He taught at a college in the state of Missouri and then moved to Long Island to a place called Cold Springs Harbor, New York. Laughlin was well renowned during that time, during this eugenics movement, often contributing written pieces about sterilization. And we're going to be borrowing from his framework today for this presentation.
Many laws borrowed his framework.
Many laws also borrowed his framework for their rationale. So he described the social inequalities that contributed to this, including being feeble-minded, insane, criminalist, epileptic, inebriate, diseased, such as leprosy perhaps, being blind, being deaf, being disabled, deformed, dependent. All of these characteristics he used as someone being an eligible candidate for sterilization. And the reason why this was approached is because of the American problems of society. So being able to work towards a healthier, more fit society here in America. So focusing now specifically on the state of California, there are 3 pictures on the slide currently. The left picture is of a female. She has short hair, wearing a dress with a flowered pattern, with a high neck collar and a solemn expression. The photo in the middle is of a gentleman wearing a jacket with a bolo tie. He has glasses, also the same solemn expression, short haircut, and the picture all the way to the right is a gentleman in a jacket and tie who also has a lapel pin on his jacket. He is wearing glasses, not smiling as well, and very clean cut. I will introduce all 3 of these people pictured now. The photo of the woman on the left, this is Dr. Olga Bridgman. As I stated, she was a doctor, so she was at the University of Michigan in pediatrics. After graduating from there, she went to California, to the University of Berkeley, to receive her PhD in clinical psychology. She's the first female to receive that degree, her doctorate in clinical psychology from the University of Berkeley. And she was working with troubled juveniles, juvenile delinquents, and doing mental and cognitive testing for the court system at the University of Berkeley, California. She also was a consultant for the California School for the Deaf at Berkeley. And so just to clarify, that school is no longer in Berkeley. It is now located in Fremont, but when we're in this time frame, the early 1800s, it was the California School for Deaf was located in Berkeley. So Dr. Bridgman was a strong advocate for sterilization on the West Coast. So the middle picture is Fred Butler. He received his medical degree in Chicago. He became the medical director for Sonoma State Hospital. And this was from 1918 to approximately 1940s. So nearly 30 years in that position. Dr. Butler managed or was responsible for over 5,000 sterilizations under his care as director. The final photograph, all the way on the right, is Dr. Elwood Stevenson. His sign name is the letter S produced on the chin. And he was the superintendent for the California School for the Deaf at that time. He was a coda, meaning he was a person who was hearing but was fluent in sign language because his parents were deaf. He graduated from Gallaudet University with a graduate degree in their teacher training program, and then transitioned to Minnesota school at Faribault, Minnesota, as the superintendent, then transitioned to California School for the Deaf. And that was 1927 to 1960, where he then retired. So the 3 of these people pictured together, their mental examinations, their screenings, would then determine if deaf students were sent to Sonoma Hospital for sterilization. So I will talk a little bit about the research that I'm currently involved in. So there's been a lot of dialogue between what Dr. Stevenson and Dr. Bridgman, the two of them communicated regularly on. Dr. Stevenson wanted deaf children to have these cognitive screenings. But Dr. Bridgman was agreeable to this. However, the location was within walking distance to the University of California, Berkeley. So Dr. Bridgman was responsible for testing 176 students between the years of 1925 and 1947. So from that number of students, there were 80 students recommended to Sonoma Hospital. Those 80 students that were recommended based on the evaluations, they were equally distributed, male and female, within that group. They were all white students. Their fathers were all blue-collar workers, such as auto mechanics, farmers, agriculture. So those 80 students are what my presentation is going to focus on, and the rationale for that collaboration between educators, psychologists, and the medical staff to provide the sterilization, and how that impacts the deaf community and what the hearing perspective of that is. So I know this slide is dense. We'll go through this very quickly. Listed on my slide currently is a chart with several columns. And this is just to illustrate that Dr. Bridgman gave several different kinds of evaluations on these students. There were verbal evaluations, nonverbal evaluations, language evaluations, evaluations of their math, their learning process, how you could level their cognitive and intellectual ability. And there's something called the Arthur Point Scale. We abbreviate that APS. And that was used most frequently. So interesting to note, the APS, the Arthur Point Scale, as I just referenced, how the test itself was designed was to be nonverbal. And what I mean by that is these children, these students, would be able to take this test irrelevant of their verbal skills. The problem is that if you give this test to these deaf students, and it's in a written form, they realized that they needed to make some adjustments to the drawings that were used, and they altered the hand shape drawings from the first edition of the testing to the second edition of the testing. So in order to illustrate signs perhaps that had a movement, they would show one hand shape and then a second hand shape. So what I'm showing here is a picture of this sign for the word fast, and it's showing both hand shapes that incorporate that sign. And so this would show if the students were working at a fast pace or if they had a slower pace for completing this test, and that was a sort of measure of their cognitive ability. So the issue with that is that giving this test to these deaf individuals and telling them you must work quickly, but not explaining how or what it entails, was not coming across clearly. So by the addition of this sign on the second edition of the testing, it seemed to clarify that. They were determining that these students on the first edition were a little slower mentally, and so they made this adjustment for the second rollout of the evaluation. So of those 80 students that were recommended for sterilization to Sonoma Hospital, I'm still working on tracking all of that information, but I have been able to isolate several deaf students who were sterilized during that time. And I have selected a few cases that I would like to illustrate for you today, so we can discuss the rationale of eugenics within the deaf community. And I'm keeping a close eye on my time. Okay, we can move along. So beginning with this case, and then we'll advance to some other examples. This student, the name was kept confidential, so it's abbreviated here. You can see they're also assigned a 4-digit number. This is showing that the student was tested 4 separate times. I believe the student enrolled at the age of 10, and that was when the first test was administered with an IQ of 73 being measured at that time. Upon the next evaluation, the IQ significantly increased to 100. So an IQ of 100 seems to be average or moderate. And then in 1937, the student, who happens to be female, and this is coming from a teacher's report and comments of a teacher, the student began flirting with some of her male classmates. And the superintendent sent the student for testing again when this behavior began, and they see that the IQ went down significantly to 72. So then, again, in 1939, the IQ decreased to 66 upon this evaluation. And with these results, the superintendent then determined the student needed to be sent to Sonoma. The student had a report card with grades that were not reflective or terrible. The grades were in the moderate or average range, and that IQ of 100, seeing that decrease to 72 or 66, seems to indicate some sort of trauma or something causing that number to decrease so significantly. How long have I been doing this? By all means.
I'd like to add here that whenever this student reached an IQ of 66 and was sent to Sonoma Hospital, she arrived at the hospital and was sterilized there. I'd like to show you another case. And this is another student, and you can see here on the screen there is a form, and I've taken the text from the form and put it on the right side of the screen. And what this form was for was a recommendation and approval for sterilization. This was another female student who went into the California School for the Deaf, was a younger student, and she was doing very well in school, progressing. It's kind of a sad story. When the student was younger, her father was caught, quote unquote, sharing a bed with her. And her father was jailed at San Quentin. He went to prison. So he was out of the home, again, because he was, quote unquote, sharing a bed with this girl. She was a student at the school in Berkeley. Her teacher reported that when the father reappeared in her life, apparently, her behavior in class became disruptive. She had trouble that she hadn't had before, and it was quite an ordeal. Again, the same testing was performed, and then it showed that her IQ ostensibly was low, and her grades showed that even though her grades showed that she was a capable student, again, it was recommended by Dr. Bridgman that she go to the state hospital. She was 14 years old and 9 months at the time that she was admitted. And that was on March 23rd of 1947. Her diagnosis was deafness and defective speech. And that was the diagnosis she received there. Additionally, they labeled her as divergent from normal mentality. We can suspect that this would have been from the trauma she experienced at the hands of her father. The girl's mother consented to her sterilization. And 52 days later, she was sterilized. I know that our time is coming to a close, so I do want to conclude my remarks. Of the 80 students that we saw recommended to be sent to Sonoma Hospital, we noticed some commonalities. Dr. Bridgman recommended institutional care for those students who met or who did not meet criteria. There were many documented children who had either behavioral or sex interest is the way it was labeled, but what this was becoming interested and flirting with fellow students. Again, from the superintendent's perspective, it was easiest to handle teenagers who started flirting with each other by shipping them out, just throwing them out of the school completely. Regarding behavioral issues, there were some very severe issues there. There were others that were documented by teachers who would say things like, that boy and that girl can't sit still. They are restless. They are fidgety. They can't hold attention. Possibly today, we would label those children as having ADHD, but back then, that wasn't a diagnosis. And for a teacher, them not being able to focus was a reason for them to leave the school. I suspect that there are many children who arrived at the school who had language deprivation. Some of them grew up in families where either their mother or father might not have been in the picture. Perhaps the father was working and the child was left to their own devices. There may not have been opportunities for communication or language acquisition at home. When it was time to go to school, when these children arrived at school, they might not have had any command of English or any knowledge of sign language. These were all new languages. And so they were late acquirers of language, way past the window of language acquisition, or that critical period that we talk about. Additionally, mental testing at this time for a child that didn't know English or didn't know sign language, at that time they would have been labeled feeble-minded. No matter what intelligence they actually possessed, there was no language there to judge or gauge that. In general, I believe that the testing done had a lot of confirmation bias. The superintendent was giving the names of the students that he wanted tested with the intention of finding a way to funnel those students out of his school. Because during that time in California, that school was the only place for deaf students. There was one. The options for deaf students to get accessible education elsewhere did not exist. And this school had a very long waiting list. So getting one student out meant that another student could get in. There were a lot of concerns about testing reliability, how the instructions for the tests were given to these students. And almost all of the tests that were given, the first, second, or third times, almost always, the IQ numbers dropped as progressive repetitions of the tests were given until they met the level where they were at criteria. Speech was always emphasized over sign. I'll go ahead and wrap up now. Again, I've picked 2 case studies to present to you here. We do have many more. In general, it's very interesting what happened at the California School for the Deaf at Berkeley. How it interplays between the school superintendent and the psychiatrists and psychologists at the hospital, what their partnership looked like. They had a very hegemonic power structure. This was all being led by hearing administrators, hearing medical professionals, hearing medical directors. And the deaf students at the school were virtually powerless. They could not challenge these systems. Parents were not able to challenge this. Many parents were poor. Some couldn't read or write. They were illiterate. Many parents were farmers. And the school told them as authorities, this is what's happening with your child, and these families accepted it. They did not challenge what they were being told. Now, the American deaf community, in parallel, people like Helen Keller, during her lifetime, showed herself as a very strong, intelligent person. And the American deaf community was trying to do the same at that time, even as the eugenics movement was spreading. The community was trying to be strong and active and lead on local, state, and national levels to structure itself through organizations led by people who were themselves deaf. National organizations such as the National Association for the Deaf, the NAD, was established in 1880. They were one of the first organizations by a disability group that was established. The NAD did have a watchdog committee that was keeping an eye on what was happening with sterilization, doing the research, and for states that did have the laws looking at what was going on. NAD did also have a membership that was predominantly white, male, and privileged. And that group did want to govern themselves. However, there might have been a eugenic flavor to some of their decisions. The hearing community provided oppression externally, but internally, NAD themselves might have had some complex positions. For example, during a meeting in 1920, NAD did announce that they would not encourage deaf people to marry other deaf people. The argument there was framed in a way to show the outside world that they could handle themselves. But many deaf people did not follow this advice in practice. Many deaf people married other deaf people. And, this became an internal discussion about deaf marriage. My last brief point here is that it's very interesting to look at other disability groups during that time. For example, people with diabetes. Those groups were put into the criteria of who could be forcibly sterilized. But when insulin came about, and I guess this would have been in the 1920s, the late 1920s, then people with diabetes got together and created a lobby to argue against being included. They said, we are capable, we can work, we can contribute, we can be responsible citizens. And they tried to move themselves out of the focus of eugenicists. Groups that had formerly been included wanted to frame themselves as responsible taxpayers and responsible members of society. So to conclude our story about the California school, this is an ongoing process of work that we're conducting, and we know through our research that in Nazi Germany, they already had been well underway with eugenics, and we're targeting many disability groups, including deaf people, both for sterilization and elimination. And so, for the American deaf community, we thought of deaf schools as safe spaces or safe havens. And they might not have been. In some ways, they might have been more threatening than we realized. So the idea of, having medical, education, psychological services provided, it all intermingles, and it's worth it for us to take a look at the way that we as society are giving credit to one group above another group, and what hearing perspectives of a disability group look like. Why would hearing people give one group privilege over another disability group? Thank you so much for your time. I really appreciate it.